there are a lot of COVID recovered patients who are suffering from societal discrimination and some sort of social boycott. Is this really required? Can COVID-19 recovered patients be contagious? Hello friends, welcome to GeoTimes. This is Dinesh. Maybe this pandemic has caused people to leave humanity and live in a virtual world of coronavirus disorder and carried away by false digital platforms without knowing the fact. There are many researchers regarding the transmission of the COVID-19 virus. A new research published by the Korean Center for Disease Control and Prevention has found that the recovered COVID-19 patients who tested positive again are not infectious. Those are the dead virus. This research may help health experts figure out who are at risk for transmitting the virus to others. The Korean study examined 285 patients who tested positive again and found that they may be dead or not fit enough to grow, and it's not infectious. And the Center for Disease Control and Prevention (CDC) in the United States attempts to answer some of these questions. When they are cultured in a laboratory, it is not replicating and found to be a dead virus. But in RT-PCR, the dead virus is also recognized and given a positive result, but that is false. Reinfection with SARS-CoV-2 has not yet been definitely confirmed in any recovered patients to date. As on date, there are many re-positive cases, but they are not transmissible and not contagious. They have less viral load and the virus is non-virulent. There are many scientists, doctors who are trying hard to evaluate the truth of transmission of the COVID-19 virus, but why it is not reaching to the mass public platforms, and even recovered patients are still facing the social stigma and alienation in this society. It's very pathetic. Sometimes I think my grandparents are correct to understand the social fabric of the community, and people are not informing even to the neighbors that the families are affected with the coronavirus. This is very dangerous, because if you are tested positive, the family members of yours, the office colleagues, friends, relatives, neighbors, etc., and even the servants will socially boycott you and try to alienate you, discriminate you at every point they meet head on head, like the office hours, playing areas, etc. I know it's a primary responsibility to maintain social distance. Sorry, it's not the social distance, it's the physical distance, because social distance means breaking the societal norms and breaking the social fabric of the society. That should not be done at any point of time. So it is the responsibility to maintain physical distance with COVID positive patients who are prone to the transmission of the virus. But to what extent? Even after they are recovered and tested negative, if the social discrimination continues, many of us will not communicate the positive cases of their families to others and try to be as normal as other persons due to fear of social boycott. This is very dangerous to the society, as this disease will spread very swiftly without knowing to anyone. I personally feel that this is like the grand old system of untouchability which should not be practiced anywhere in the world. So why is the stigma against the COVID? It's a new disease with many unknowns and confusion, fear, anxiety among public. These factors fuel harmful stereotypes which are dangerous. And what stigma does to the COVID-19 patients? It drives public to hide illness to avoid discrimination, and people prevent from seeking healthcare immediately, discourages them from adopting healthy behavior, and do not harass, abuse, hurt or harm anyone with COVID-19 symptoms, because it's not their fault. Don't discriminate them, and every cough and sneeze doesn't mean COVID-19. Stay positive and take care of mental health, because the COVID-19 patients are suffering from depressions, mental stress, agony, anxiety, etc. And do not stigmatize people in home quarantine. Remember, COVID-19 will heal, but stigma and mental trauma left behind won't. Novel coronavirus does not discriminate any race, caste, creed, religion, etc. And why should we, the community, should discriminate the COVID-19 patients who are recovered and now living a normal life? It's time to show compassion, assurance, respect, and the encouragement. And stigma affects the emotional and mental health of those stigmatized. And do not stigmatize healthcare service professionals, because those are the frontline personnel who are fighting this pandemic in a very aggressive way and with a positive attitude. And do not even discriminate migrant workers. Just practice self-isolation for 14 days and immediately inform the local health care workers who will take care of their quarantine schedule and the test, etc. And integrate them back into your community. Because of the COVID-19, many businesses have really shut down and looking for a great opportunity to develop for themselves. Please give them opportunity. Do not stigmatize them. Do not socially boycott them. The mayor of Florence, Italy, initiated Hug a Chinese campaign for the unity in this common battle, and many Italian netizens responded by posting photos of themselves with the Chinese. And this is one of the main reasons for the spike of Italy's COVID-19 cases. So the conclusion here is humanity rules over myths and illusions. Don't discriminate, don't alienate, and don't boycott any COVID recovered patients. They have already recovered and the virus is non-virulent and non-contagious. Not even suggesting you to hug a COVID recovered patient, but by maintaining physical distance and let them live their lives happily. After all, it's about living peacefully on the Mother Earth. Give them a chance. Thank you. Jai Hind.